An HIV-positive patient presents with acute onset of high fever, productive cough, and pleuritic chest pain. I'm showing you a frontal chest radiograph and an axial chest computed tomography scan. Describe the findings.
The chest radiograph demonstrates a dense, homogeneous focal consolidation in the middle lobe with visible air bronchograms. There is no significant hilar or mediastinal lymphadenopathy. The axial chest computed tomography scan confirms focal lobar consolidation in the middle lobe with patent air bronchograms. No associated pleural effusion or significant adenopathy is identified.
Based on these imaging findings, what is your primary diagnosis and the next most likely differential?
The primary diagnosis is community-acquired bacterial pneumonia. The second most likely differential diagnosis is pulmonary tuberculosis, which is also common in HIV-positive patients.
If I tell you the patient's CD4 count is relatively preserved at 280 cells per microliter, how does this guide your diagnostic hierarchy?
A CD4 count above 200 cells per microliter indicates relatively preserved cellular immunity. In this stage, community-acquired bacterial pneumonia is the most common cause of focal consolidation, while opportunistic infections like pneumocystis are less likely.
How often does pneumocystis jirovecii pneumonia present with focal or lobar consolidation?
Pneumocystis jirovecii pneumonia presents as a focal consolidation in only about 10% of cases. It classically manifests as diffuse, bilateral, symmetric ground glass, or interstitial opacities.
Are recurrent bacterial pneumonias considered an AIDS-defining illness?
Yes, recurrent bacterial pneumonias, defined as two or more episodes within a 12-month period in an HIV-positive patient, are classified as an AIDS-defining illness.
What are the most common bacterial pathogens responsible for pneumonia in HIV-positive patients?
The most common pathogens are Streptococcus pneumoniae, followed by Haemophilus influenzae and Staphylococcus aureus.
How would the presence of hilar or mediastinal lymphadenopathy accompanying the consolidation alter your diagnosis?
If the consolidation were accompanied by mediastinal and hilar lymph node enlargement, pulmonary tuberculosis would become the primary diagnosis, as adenopathy is characteristic of tuberculosis in immunocompromised patients.
What other opportunistic infection can present as focal consolidation in patients with advanced immunosuppression?
Mycobacterium avium intracellular complex, fungal infections like cryptococcosis, and Kaposi's sarcoma can occasionally present as focal consolidations in advanced immunosuppression.
State the critical safety warnings and management precautions for an HIV patient with a CD4 count below 100 cells per microliter.
In patients with severe immunocompromise where the CD4 count is below 100, there is a high risk of necrotizing pneumonia and cavitation caused by Pseudomonas aeruginosa or methicillin-resistant Staphylococcus aureus, which carries high mortality.
What are the immediate clinical management recommendations for this patient?
Shadowing is related to sound. Shadowing is related to sound attenuation, which involves reflection, scattering, and absorption of sound.